It's a time of week where we answer some of your common health questions. As always, joining us, News Channel 5's medical expert, Dr. David Soria, the Chief of Emergency Medicine at Wellington Regional Medical Center. Thanks so much. Nice to see you.
You too.
First off, we're talking about are there ways to lower blood pressure without using drugs?
Yeah, there sure are. And lifestyle comes into play quite a bit when it contributes to hypertension. Really, we try to use that first, or try to recommend that long before we use any medicines. So a couple things are important. One is you gotta lose weight. Increased weight clearly increases blood pressure.
Okay.
Exercise regularly. Studies have shown that if you exercise about 30 minutes per day, you can decrease your blood pressure about 10 points or 10 millimeters of mercury.
That's
so
pretty
very
significant,
important.
yeah.
30 minutes a day is a lot though, so you really got to get into a good regimen. Eat right and eat healthy. Veggies, fruits, whole grains, things like that. Avoid things like caffeine, things like that can increase your blood pressure.
Okay.
And then also no alcohol, no tobacco. If you eliminate all those things, I think in combination, I think you'll see quite a bit.
I'm snickering because all the things we know we should do, but sometimes...
I didn't mention chocolate though.
Oh
so,
gosh, don't you
it
dare
always
go
seems to
there.
come into play.
What about migraines? Is there anything we can do to prevent them?
Hey, with all the research that we've done on migraines, we still don't know a lot about it, but we do know that it's a vascular dilatation in the brain that irritates the nerves surrounding and causes this throbbing pain. And we also know that there's certain triggers. Too much caffeine can trigger a migraine. Things like that. Lack of sleep, lack of exercise, and then there's also certain foods that would want you to avoid. So for example, foods that have tyramine, wines, aged cheeses, and also foods with MSG, well known to trigger migraines, Chinese foods, spicy foods, things like that, avoid. And despite all that, you're still going to have migraines if you're prone to them.
Yeah.
So unfortunately, try those techniques. If it doesn't work, then obviously see your doctor, and medicines will have to.
Let's hope that does work. All right, thanks, Doc.
You're
if you have a
welcome.
question for Dr. Soria, you can send it in by going to our website, WPTV.com. Click on the help link, scroll down on the right, you'll see a form. You can write your question right there. Thanks for coming in, Dr. Soria. We'll see you next week.